So I'm just curious, what made you decide to work at Odessa Brown?
It's hard to believe if you're not there, but it really is a family. And everyone seems to have really the same mission that's really focused on the patients and the families that we serve.
I have to imagine this, maybe it's what you kind of aspired to when you got into medicine in terms of being able to help people.
Yeah, absolutely. I think it's it is a community, and I think having a clinic that serves the community is unique.
I'd love for you, since you have a background in equity and diversity when it comes to healthcare, for those who don't understand, okay, healthcare and the issues with equity, how do you explain that?
So in healthcare, as in education, as in any other industry, each individual person, their family, their community, they're going to have different needs that need to be met. And as healthcare providers, we need to be able to meet those individual needs. The goal is to have for pediatrics, right, is have every child to meet their full potential. And so to do that, that might look really different for family A versus family B, right? For child, even for those of us that have more than one child at home, we know that some children need a little bit of help with homework, some need a lot. And so that's what equity is really about, giving individuals and families what they need to reach their full potential, and not trying to figure out, okay, everybody's gonna have the exact same thing.
And I'm curious, how is this second clinic going to help further the OBCC mission?
I'm originally from California, so I don't have a long history in the Central District, but I know of the history, and it's similar to many other urban areas, right, where we have seen gentrification and rising prices to live, and families being pushed out further and further from the city center as prices go up. So as we see that happen, the families that need us the most, sometimes it's really hard for them to reach us.
How would you describe why it is so important to support this clinic?
The health for us is larger than medical needs. It's health and well-being, and I think we see it as a holistic way. So there's mental health, behavioral health, and not just when there's a disorder or a problem, but it's that prevention that's so important. So I think as families try to come out of this COVID pandemic on the other end with children who are healthy, who are developing well, and who are going to get right back into school and reach their full potential, that's what the contribution, I think, does